Hi, my team and I are here today to inform you about health awareness. Firstly, we will discuss reflective practice and interprofessional collaborative care, so we can enlighten your community about how these methods can improve the health professionals in your area. Then, Nirvana will discuss the inequality in access to healthcare for this rural and remote community, followed by Kate, who will notify you about the lack of clinical decision and support and professional development for rural healthcare providers. I myself will tell you about the poor health outcomes amongst the community's Indigenous Australians, and finally Tessa will discuss the reluctance of newly settled migrant women and children to seek healthcare. Reflective practice is an ongoing dynamic process of thinking critically and honestly about your experiences. This allows you to identify your strengths and weakness while assisting you to improve yourself through the reflective process. Reflective practice was introduced by Donald Schwann in 1995. He was first to recognize the need for an approach that assisted practitioners to respond to situations that were ill-structured or unpredictable. In order to critically reflect, it is important to cast aside biases and prejudice and become more aware of your own mental process, to make non-judgmental decisions to assist you. This is called mindfulness.
Benefits of reflective practice. Remote and rural practice offers many opportunities for reflection and provides a host of benefits to those who use it correctly. This includes supporting evidence-based practice. The issues that are faced by clients and practitioners in a remote or rural context are often complex and difficult and require problem solving to reach the best solution. Proper application of reflective practice allows for increased understanding of issues, which helps the healthcare worker not only consolidate their own knowledge, but also explain upon it. This expanded knowledge will help to inform future decisions of not only the initial practitioner, but also the healthcare community as a whole by making complex problem solving easier. The use of reflective practice is highly regarded, and most participants find significant positive long-term changes to clinical practice. Gibbs model of reflection. There are many different models used in assisting development of reflective practice. This includes Gibbs model of reflection. Gibbs model of reflection can be used to promote and explain evidence-based practice in many different scenarios. This can be seen in a real scenario that was presented by a student at the following website. I will explain the scenario in detail using the Gibbs model of reflection, which can be seen on this diagram. The first step in Gibbs cycle of reflection is description. A patient came in, was conscious with chest pain, and was upright and talking to him properly. Second on the Gibbs cycle is feelings. The student was nervous because it was his first chest pain scenario and was thinking the worst due to the content of lecture, as they had been doing a lot of cardiac arrest. Next comes evaluation. The student was able to obtain good information through a structured primary-secondary survey, but he was struggling to take the information in and couldn't look at the bigger picture, which evidently is to treat what is in front of you. Then he went on to the analysis state. As a result, he wasn't able to see the bigger picture to understand what was happening to the patient. He knew the fundamentals and could gain knowledge from this, but wasn't able to put it all together. In conclusion, if a similar situation arose, he would do a few things differently. He knows that now. He wouldn't go into the scenario with any expectations. He would still approach the scenario in the same structured way, with initially his primary survey, Dr. ABC, followed by his secondary survey to develop a treatment plan. And he would actively listen and repeat back information to himself to confirm treatment and management options. He feels a lot more confident now doing a chest pain scenario, as he knows how to structure his approach, ask the correct questions, and repeat the information back to the patient so he can create a solution to the problem in front of him. Health professionals in your community can use the Gibbs model of reflection to reflect and critique on many different scenarios so that you can improve on your healthcare service to your patients.